Let's unpack all of these numbers with the NICD's Professor Cheryl Cohen. Prof, good afternoon. Thank you very much for your time. First up, can you just talk about the fact that there are more deaths among COVID-19 cases of people who are unvaccinated compared to those who've been vaccinated? What does this tell us?
So I think it tells us what we expected to see with Omicron and what we've seen with all the other variants, which is that vaccination is really very effective against preventing severe disease. So even though in some cases, particularly with new variants like Omicron, we might see more breakthrough infections. In other words, people who have received the vaccine could still get COVID. This disease is really much milder, and the vaccines really do appear to be robust in terms of preventing the severe outcomes, including hospitalizations and deaths. So I think this is very positive data. It confirms what we expected to see, and I think the important thing is really that everyone who hasn't yet been vaccinated should really go out and get their vaccine or their booster or their second dose, whatever they're eligible for, but they haven't had yet, to make sure that they're protected against these severe outcomes.
Yeah, last week I interviewed one of your colleagues, and I was just wondering if and when, or will we know, how many of the deaths that we're seeing are due to Omicron?
So I think, it's important to note that certainly most of the cases that are diagnosed, we don't actually perform that sequencing test to actually check like which variant is causing it. But what we do know is that Omicron came into South Africa and has rapidly replaced all the other variants. So we estimate more than 98% right now of cases in South Africa are due to the Omicron variant. And so certainly the recent cases, hospitalizations and deaths that we are seeing, the vast majority we would expect are due to the Omicron variant, because even though we only sequence a subset, we see a picture that right now in South Africa, overwhelmingly, Omicron is by far the most common variant, and almost all of the disease that we are seeing is caused by this variant. Okay,
with Omicron, we saw earlier when it was being discovered that a higher number of children were being infected, but now I understand it's moved now to the older ages. Is that the case?
Yeah, so I think it's important to note, I don't think actually it was ever a higher number of children that were infected. I think what we saw is that the proportion of severe cases in children was more compared to adults. But in fact, there's a lot of data that's coming out now that suggests that really what's happening is that the disease in adults is much milder than it used to be. So I think there's quite a lot of data now that's suggesting that in fact the illness in Omicron is in fact likely less severe than in with previous variants. And so some of this apparent shift to children could actually just be that there are lots of Omicron cases in the population that aren't diagnosed because they're very, very mild. And so we're sort of seeing this overlap in children, or this overflow into children. But certainly what has happened is that trend where very early on it looked like there were proportionately more children, that's really coming down and sort of normalizing. So the proportion of children has gone down quite a lot. And I think always right in the beginning of the wave, you do sometimes see these aberrations in data or apparent, strong signals that often tend to normalize a bit as the epidemic settles.
Yeah, your colleagues earlier, when they presented the update, they were saying that, among other figures, 70% of South Africans have now actually been exposed to the coronavirus and have underlying immunity to COVID-19. What's the significance of this?
I think it's really important, this fact. There's a number of pieces of data. Some of it is from seroprevalence studies where they test blood from people and tested for antibodies. And there was an important study from Gauteng. The information was released last night, which gives seroprevalence data from Gauteng, confirming these data of Dr. Groom. And we've also done surveys in other provinces that show very similar data in Mpumalanga province as well as in Northwest province, and the mathematical models confirm this, that about 70% of people have had COVID, and most of those infections would have not been diagnosed and potentially have been quite mild. But what it means is that this is really affecting the appearance of the disease now, because we know that we earlier talked about how vaccination causes, if you have a breakthrough infection with vaccination, it's less severe. The same is likely with previous infection. And so people who've had previous infection, they might catch Omicron, because we do see the so-called immune escape, that even if you've had a previous infection or vaccination, you do catch it, but it goes on to become less severe. And so I think this is very important. It goes with the observed data that we see, which is what we call the decoupling of cases and hospitalizations. In other words, the cases are very high, but the percent of cases that are being admitted to hospital in this wave are much lower than in previous waves. And a big contributing factor to this is probably the fact that so many people have had previous infection. So when they catch Omicron now, they are less likely to go on to these severe outcomes of hospitalization and mortality. So I think it's very positive for South Africa, and as we think forward to potentially future waves.
Is this the beginning of the end of the pandemic?
I certainly hope so. You know, I never make predictions anymore, because whatever one predicts with COVID, one is wrong. But I think what is good is that there are some sort of more positive results coming out, in that even though we have had the severe wave and it has had some certainly negative consequences, you know, that the disease does appear to be less severe. I think what is very, very important, though, is that people, you know, you mustn't let down your guard. Vaccination is so important, especially on an individual level, to protect yourself against severe disease, and all those other measures, you know, like masks, etc., and physical distancing. We do still need to keep on implementing them, but hopefully it is an optimistic signal.
Yeah, let's hope so. Can I ask you a general question around when could we reach population immunity? Just the answer you gave a short while ago suggests that with 70% of people in South Africa having been exposed, therefore that is somehow contributing to the milder symptoms we are seeing in people who do catch the Omicron variant. When could we be saying we're going to reach population immunity, or so-called herd immunity?
So I think it's very important to understand this concept. What we know is that these new variants of COVID are actually very infectious, right? Much more infectious than the first strains that first came into the country. And so we are never going to see what they talk about exceeding the herd immunity threshold. That's when there's so many people in the population immune that the virus goes away. That's not going to happen ever with these new versions of COVID that are more infectious. But that doesn't mean that population immunity isn't contributing to reducing the spread of disease or the severity of the disease. So already, the fact that so many people have immunity is certainly contributing what we see with the Omicron wave. It's likely contributing to the shape of the curve, the rapid upswing and the rapid downswing, and it's almost certainly contributing also to the reduced severity of disease that we're seeing. So population immune effects in South Africa already are having an important effect, and the hope is that going forward these immune effects would continue to lead to, if there are subsequent waves, that they are lower and less severe, and that Omicron or COVID should start to become more like other respiratory viruses. So they don't go away, but they have a season like flu, comes in the winter every year, but it's not, you know, it doesn't have this huge effect in terms of disruption, and some of the public health measures, hopefully in the future, we could also start to relax those as population immune effects you know, kick in. I think what's important to note, though, is that with COVID, you never know. So, for example, Omicron seems to have a lot more immune escape than previous variants, and so it caused a bigger wave than you know we would have seen had we had a Beta or Delta. Now, with our high levels of immunity, we wouldn't have seen such a wave. So I suppose it remains possible that we could see another variant that with even more immune escape. But I think already we are certainly seeing the effects of population immunity in this current wave.
And the fact remains, just to conclude, Prof, that the non-pharmaceutical interventions, wearing of masks, washing of hands, sanitization, physical distancing, avoiding crowded areas, gathering, are still very much valid. Plus the fact that if you do vaccinate and you do get infected and you end up in hospital, you are likely to survive if you have been jabbed.
Absolutely, and you're much less likely to end up in hospital. So people who are vaccinated are much less likely to end up in hospital. So if you do catch COVID and you have had the vaccine, you are much less likely to have very severe disease. So really, and vaccination is something we really have control over, and it's a lot easier than wearing a mask every day, etc., all those other things. So really to recommend people to get their vaccine, as well as absolutely all the measures you've mentioned.
Thank you very much, Professor Cheryl Cohen. She's, of course, from the NICD, that's the National Institute for Communicable Diseases.